Hello everyone, I am Dr. Donald Ozello of Championship Chiropractic in Las Vegas, Nevada. Welcome to today's episode of Dr. Ozello's Sports Medicine Report. Today I'm going to continue talking about low back pain and its contributing factors. Today's subject is going to be on tightness, or what is known as hypertonicity of the hip flexor muscles. The hip flexor muscles are the big, strong, powerful muscles in the front of the hip. When contracted concentrically, that means in the positive manner, they bring the thigh closer towards the upper body. So if you are standing and you flex the hip concentrically, it will raise the thigh towards the chest. If you are laying face up and you contract the hip flexors concentrically, it will move the thigh and the knee towards the chest. So the hip flexor muscles, they flex the hip. The hip flexor muscles are made of the psoas muscle and the iliacus muscle. These muscles actually merge together and become what is known as the iliopsoas muscle. This is a strong, powerful muscle. The opposing muscle is the hamstrings and the gluteus maximus muscle, which perform hip extension, which is, if you are in a standing position, hip extension is moving the thigh backwards. The psoas muscle actually originates on the side of the vertebrae in the low back. The low back is named the lumbar spine in medical terminology, and the psoas muscle originates on the sides of the vertebrae in the intervertebral disc in the lumbar spine. Then it travels down and attaches to the front of the pelvis. The iliacus muscle originates in the front of the pelvis, and these muscles merge together and they attach to the inside part of the femur, which is the thigh bone. It's very important that you realize that they originate on the spine, attach to the pelvis, and attach to the femur. Hypertonicity is the medical terminology for tightness in a muscle. If a muscle is hypertonic, it can pull on the bones that it attaches to. So you think about it, if the hip flexors are tight, it can pull on the spine, the pelvis, and the thighs. So if you are laying face up and those muscles are tight and you have your hips straight and your knees straight, there can be a tremendous amount of pull on the spine, on the pelvis, and on the thigh if there is tightness in the hip flexor muscles. The hip flexor muscles often become tight when we sit for a long time. You think about many jobs exist nowadays where we are sitting for a long period of time. Prolonged sitting will cause hypertonicity in the hip flexor muscles. Also, prolonged standing will cause hypertonicity in the hip flexor muscles. These muscles get tight and they start to pull on the spine, the pelvis, and the hips. This can create pain or symptoms throughout that entire area. When we speak about prolonged sitting causing hypertonicity of the hip flexor muscles, if you think about it, there are many people who sit at a desk for long hours, more than 8 hours a day. Even if they are in a proper ergonomic position and they have their workstation set up exactly how it should be, the muscles will still tighten. Our muscles are made to be in motion. The human body has been developed to move. So prolonged sitting, staying in one position for too long, causes the hip flexor muscles to tighten. Tightness in the hip flexor muscles causes an abnormal pull in the spine. This can lead to poor posture and poor movement patterns and symptoms in the low back, including tightness, stiffness, especially after you've been laying down for a long time or you've been sitting for a long time. Stretching and foam rolling the hip flexor muscles is extremely important in reducing muscle tension in that area. Stretching the hip flexor muscles can be performed as a preventative measure and as a rehabilitation tool. You can use it for acute injuries or you can use it for chronic injuries. I have already done a video on hip flexor strain, so I will make sure that there is a link to that video on the end of this video. I've also done a video on hip flexor stretching, so I will make sure that that video is attached to the end of this video also. So please do yourself a favor and watch those videos so you learn a lot about hip flexor strain and you learn a lot about hip flexor stretching. I have also done videos on those muscles in my 2 Minutes of Anatomy show. So you can watch those videos and learn about the anatomy of the hip flexor muscles. I know I gave a brief explanation in this video, but in that video, there will be a greater explanation so you can learn a little bit more about these muscles and help to prevent this contributing factor and help to eliminate this contributing factor of low back pain. Now it is time for the disclaimer. The disclaimer. Viewing this video does not take the place of seeing a medical professional or working with a rehabilitation specialist or a certified fitness trainer. Please see a medical professional to get an evaluation, to get a proper diagnosis, and to help you on your path to recovery. You can work with a rehabilitation specialist to help you to recover if you have tightness in the hip flexor muscles or if you have an injury to the hip flexor muscles, and you can work with a certified fitness trainer to help you to learn proper exercise technique to eliminate this contributing factor and also to prevent this contributing factor. You can learn to stretch the muscles, and you can learn to strengthen the opposing muscles or any other muscles that may need to be strengthened. When you are performing any type of exercise, it doesn't matter if it is a strengthening exercise, a stretching exercise, or a motion exercise. Always work through a symptom-free range of motion. If any exercise elicits or intensifies symptoms, please stop immediately and find a viable substitute. When performing any type of exercise, always work through a symptom-free range of motion. Those symptoms can be pain, numbness, tingling, burning, just an abnormal sensation, not only in the area that you're working, but any place. So please never perform an exercise that elicits or intensifies symptoms, and always work through a symptom-free range of motion when you're performing any type of exercise. There are many factors that can contribute to low back pain, and tightness, otherwise known as hypertonicity of the hip flexor muscles, is a common contributing factor to low back pain. So please keep those muscles very pliable. You can stretch those muscles, you can perform foam rolling on those muscles. Obviously, you want to be as safe as possible and use proper technique when stretching and foam rolling the hip flexor muscles. You want to strengthen the surrounding structures. You can strengthen the hip adductor muscles, which are the muscles on the inside part of the thigh. You can strengthen the core muscles. You can strengthen the gluteal muscles, the gluteus maximus, and the hamstring muscles. Again, the gluteus maximus and the hamstrings perform hip extension, which opposes the hip flexor muscles. The hip flexor muscles can become tight with prolonged standing or prolonged sitting. So please make sure that you switch positions or even take what I call a micro break, where say if you're sitting for about 15-20 minutes, just stand up and stretch. You can reach towards the ceiling, you could shift your hips around, you can do circles with your pelvis, you can do any type of motion just to break that static positioning, even if it's for 20 seconds, and then sit down and get back to work. And then every hour you get up and move around. This will help to break the static positioning and help to prevent hypertonicity of the hip flexor muscles from prolonged sitting. Thank you everybody for viewing today's episode of Dr. Ozello Sports Medicine Report, where I spoke about hip flexor muscle tightness, or like I said, otherwise known as hypertonicity in medical terms, as a contributing factor to low back pain. Do everything you can to prevent low back pain and to rehabilitate low back pain. Like I stated before, please see a medical professional so you get a proper evaluation, diagnosis, and treatment plan. I am Dr. Donald Ozello of Championship Chiropractic in Las Vegas, Nevada. I am the author of Running, Maximize Performance, and Minimize Injuries. You could learn more about my book by visiting my website, championshipchiropractic.com. Also on my website, you can find my blog. My blog contains articles on sports medicine, spine health, nutrition, health, fitness, and exercise. Please feel free to like this video. If you have questions, feedback, or suggestions, please leave them in the comments section below. Please subscribe to my YouTube page, Dr. Donald A. Ozello, DC. Thank you again for watching today's video, and always remember to train hard, but train smart. Get adequate rest between training sessions. Utilize nutritional and supplementation strategies that work for you. Rehabilitate your injuries, and even better, prevent injuries and accomplish your goals.